Blessings University Substance Abuse, a Biblical Perspective course. Thank the Lord for blessing us to be here another evening. And at this time, we're going to start off with a word of prayer. Dear Heavenly Father, we come before you. We just thank and praise you for another day. We thank you, Lord, for your many blessings. We ask that you would give us wisdom, understanding, and revelation knowledge of your word. Help us to hide your word in our heart that we will not sin against you. Give us wisdom, Lord, and understanding, Lord, of substance abuse and how, Lord, to entreat those, Lord, that are dealing with substance addiction. And we just ask that you would continue to strengthen us and word our mouth. In Jesus' name, amen. So I want to kind of just go over a little bit of an overview from last week. We just talked about substance use disorder and what it is. And it is a disorder which is uncontrolled use of substance despite destructive consequences. So you might have a lot of things going on in your life, and if you're addicted to substances, they're creating majority of those problems. And even though you know that your substance use is creating the majority of your problems, you continue to use because you have no control over the substance. It has control over you. So that's just kind of a little overview. We're going to go right quick. Right. Ready. We're going to be having a quiz. So get your papers and pencils if you haven't gotten them out yet. Anyone need a paper? Get these out right quick, 1 second. All right, I forgot to give those out earlier. Okay, question number 1. What is the most common stimulant used in the world? What is the most common stimulant used in the world? A, Adderall, B, caffeine, C, cocaine, D, nicotine. A, Adderall, B, caffeine, C, cocaine, D, nicotine. Question 2. Cocaine was an ingredient in Coca-Cola's original recipe. True or false? Cocaine was an ingredient in Coca-Cola's original recipe. True or false? Number 3. What is the most common depressant used in the world? What is the most common depressant used in the world? A, Xanax, B, alcohol, C, phenobarbital, excuse me. Some of these words are going to be difficult for me this time. And D, Rohypnol. A, Xanax, B, alcohol, C, phenobarbital, D, Rohypnol. Question 4. Sugar can contribute to depression. True, A, true, B, false. Sugar can contribute to depression. A, true, B, false. 5. What is the most common hallucinogen used in the world? A, PCP, B, mescaline, C, LSD, D, magic mushroom. A, PCP, B, mescaline, C, LSD, D, magic mushroom. What is the most common hallucinogen used in the world? Yeah. 6. Bath salt is a hallucinogen. True or false? Bath salt is a hallucinogen. A, true, B, false. Number 7, what is the most common narcotics used in the world? A, oxycodone, B, fentanyl, C, heroin, D, opium. A, oxycodone, B, fentanyl, C, heroin, D, opium. Number 8, Americans consume 80% of prescription narcotics in the world. A, true, B, false. Americans consume 80% of prescription narcotics in the world, used in the world. A, true, B, false. Number 9, what is the most common inhalant used in the world? What is the most common inhalant used in the world? A, room deodorizer, B, gasoline, C, paint thinner, D, Drano. A, room deodorizer, B, gasoline, C, paint thinner, D, Drano. Number 10, air dust is a common abused inhalant. A, true, B, false. Air dust is a common abused inhalant. A, true, B, false. And for those of you that don't know what air dust is, it's the cleaner that you use to clean, like if you're going to clean your keyboard, you use that can of spray, and it just blow out air. That's what air dust is. So we're going to be talking about the major types of drugs, which is your stimulants, depressants, hallucinogens, narcotic analgesics, and inhalants. Okay, so stimulants are a class of psychoactive drugs that increase, we're going to be talking about stimulants first, sorry. They are a class of drugs, psychoactive drugs that increase activity in the brain. These drugs can temporarily elevate alertness, mood, awareness. Some stimulant drugs are illegal and widely used. Many stimulants can also be addicting. Stimulants share many commonalities, but each has unique properties and mechanisms of action. Drugs that are classified as stimulants include caffeine, ecstasy, methamphetamine, cocaine, prescription stimulants, and nicotine. So we're going to go to caffeine, because we know everyone loves that cup of joe in the morning, right? Some people just can't function without it, right? I know people hit Starbucks every morning on their way to work. So caffeine is a stimulant. So caffeine is a stimulant drug, which means it speeds up the messages traveling between the brain and the body. It acts as a central nervous system stimulant when it reaches your brain. The most noticeable effects is alertness. So everybody say, oh, I cut down my cup of coffee so I can wake up in the morning. So it does, it affects alertness. You'll feel more awake and less tired. So it's a common ingredient it's a common ingredient in medications to treat or manage drowsiness, headaches, and migraine. It's found in the seeds of nuts and leaves and a number of different plants, including those used in coffee, tea, soft drinks, and then also cocoa or chocolate. Okay, so there's different types of things. So like chocolate candy has caffeine in it. Different nuts, almonds, and things. Teas have caffeine in it. Your sodas, your energy drinks have caffeine. Question?
So understanding that caffeine is a drug, and I think you kind of hinted toward this on last week, where I guess there are some people that are more acceptable of certain drugs, such as caffeine, which we know is a stimulant, but we also see that there is this push in society to, I guess you should say, try to make things that were once outlawed more acceptable in the culture today. And I guess the question I have is, when we're playing that line of what should we deem appropriate and not appropriate, where should we draw the line at? Because, caffeine is a drug, but, people are accepting.
Right. That's a drug. And that's why people don't realize the reason why they go for that cup of Joe every morning is because they are addicted. They just think that, it's just coffee, coffee's good for you. Half and half.
I think it's like, because it's cold in the winter, I'm mostly like,
right. I'm like that too. I'll drink, coffee here and there,
yeah.
But I'm not a big coffee drinker. But you're what? You're a binger?
Yeah, every now and then I'll go the whole week, and I'll have it in the morning and in the evening if I can get it in between. But I'll have my whole week, and then I'm off for a while and go back to my teas.
That's a good example of a binger. They get on it for a while, and then they're off. Until before you know it, sometimes those binges become a little bit more frequent. So, not saying that's you, but I'm just saying for a lot of people that happens. As to your question, Pastor Carter, certain states trying to pass laws that certain, what do you call it? Sorry, I can't think of the word right now, but certain drugs that are deemed only for medical purposes, stuff like that, they're trying to get them legalized, just for recreational use. So with the passing of the marijuana, now and say, okay, we got that through, let's get the next thing through, So, before, back in the day, alcohol used to be illegal. You couldn't get it. They was getting it, then they put a stop to it, and that's when the prohibition and stuff like that came along, and then they made it legal again. So now it's the marijuana. So now that the marijuana is legal in pretty much all the states, I believe now, they're trying to push, for other drugs and stuff. And so,
if I'm not mistaken, with marijuana, states have made it acceptable, but it's still a federal crime.
That's correct. Yeah. That is correct. It still has not been federally legalized. But I'm sure there's people out there pushing for it.
So buy it, opportunities to buy it, and then it's not.
So where that is really states have essentially said we're not going to prosecute it, but the federal government can come in and arrest people because it's a federal crime, which is why some of those businesses that like dispensaries are unable to bank with various banks because it's a federal crime. So then they kind of getting involved in money laundering and all of that stuff. But one of the things they'll always say it's safer or for tax purposes and all of these things to to manipulate the narrative. But I think we in the church have to be aware because, you know, like they said with marijuana, oh, we're doing it for medicinal purposes, but we see how quickly it went from medicinal purposes to recreational use of drugs. And now we're seeing places like Oregon trying to legalize magic mushrooms and all this other stuff. So we have to stay vigilant as people die.
It's so important that we stay up with what's going on in our world too. A lot of times we just kind of, you know, go home, we watch the news, we watch our favorite program or something, you know, but we're not up on what's really going on in our world. And it's important. So even on the state and local levels, when they're passing these laws, we need to be voting so that our vote could be heard on these issues. Because a lot of times these issues are going unnoticed, you know, because they're slipping this stuff in and we're not, you know, aware of what's going on. So it's important to be aware. Okay. So our next stimulant is ecstasy, or MDMA. It is a synthetic drug first developed by German chemist Anton, can't pronounce his last name, in 1912. The drug was tested over and over for decades. First, it was used as a potential cure for internal bleeding. Later, as a synthetic version of adrenaline, and later still for its psychoactive effects. Recreational use of ecstasy became popular in the 70s and 80s when young people began using the drugs to avoid strict criminalization of drugs like cocaine and LSD. Ecstasy goes by different names such as Molly, E, X, and Atom, among others. Ecstasy combines the effects of the stimulant amphetamines and the hallucinogen mescaline, creating a unique high. So what they've done is they put two different medications together, which is amphetamines. And amphetamines is mostly in your cold medication, and then hallucinogen mescaline, and to create this drug, ecstasy. So some of the side effects, when someone takes ecstasy, the drugs act on 3 neurotransmitters in the body's central nervous system. These neurotransmitters, are serotonin, which is known to affect, among other things, mood, sexual arousal, and then the dopamine, which controls the brain's reward and pleasure center, and the I'm sorry, I just have a hard time with these names, which controls the body's functions of sleepiness and wakefulness. So physical and mental effects: a sense of tense well-being or euphoria, a feeling of excited calm or peace, feelings of well-being, heightened sensitivity, increased physical and emotional energy, increased sociability and closeness, relaxation. So what this drug is doing is causing people to have a sense of, on one hand, a sense of well-being, okay? But then on the flip side, the negative and harmful side effects are sweating, the loss of full control of body movements, blurred and double vision, changes in perception, dry mouth, empathy, mild intoxication, and muscle tension. Okay, and then it also will raise your heart rate too. So yeah, so ecstasy, again, like I had read earlier, was in the 70s and 80s it became popular with a lot of party goers that were, because they were getting in trouble with the cocaine and LSD and getting arrested and stuff. And so this is a synthetic version that basically kind of does the same thing that the cocaine is synthetic. Yes. Okay, so our next drug is cocaine. Cocaine is a stimulant drug, which means that it speeds up the messages traveling between the brain and the rest of the body. Cocaine comes in leaves of the coca bush, which is native to South America. The leaf extract is processed to produce 3 different forms of cocaine. Cocaine hydrochloride is most commonly snorted. It can also be injected or rubbed on the gums. Freebase and crack cocaine are usually smoked, ingested. Indigenous people of South America are traditionally chewing the leaves of the coca bush for their stimulant and appetite suppressant effects. Street dealers often mix things like cornstarch, talcum powder, or flour to increase profits. So, yeah, so you're not, yes, flour, I'm sorry, to increase the profit. So you're not getting straight cocaine. They're cutting it, yes, definitely. Okay, so they may also mix it with other drugs such as stimulant like amphetamine or synthetic opiates, including fentanyl. Adding synthetic opiates to cocaine is especially risky when people risky when people using contains this dangerous additive, especially the fentanyl, because it's so hard to gauge the fentanyl and it doesn't take much to kill a person. Yes.
Now, is the fentanyl the embalming fluid, or am I mixing that with something else?
Something else. So yeah. So fentanyl would go under the classification of the narcotic analgesic. So cocaine increased levels of the natural chemical message dopamine in the brain circuit related to the control of movement and reward. So a lot of times that's why we see people that are stumbling, they can't, keep their balance and stuff, because a lot of these drugs are affecting that movement. So normally dopamine recycles back into the cells that released it, shutting off the signal between nerve cells. Cocaine prevents dopamine from being recycled, causing large amounts to build up in the space between 2 nerve cells, stopping their normal communication. This floods the dopamine in the brain reward circuit, strongly reinforcing drug-taking behaviors. Because the reward circuit eventually adapts to the excess of the dopamine caused by cocaine and becomes less sensitive to it. As a result, people take stronger or more frequent doses as an attempt to feel the same high and to obtain relief from withdrawal.
Okay, so that's what causes crack addicts to be crack addicts, because they have to have more and more to get that same high.
Correct. And that's what a lot of drugs, that's the whole process of addiction, is because of the way it works in the brain with the dopamine and stuff like that, it causes them to have to, because they're still chasing that high. So you have to use more and more. And so what they tend to do is they use it more frequently and then more of it. And that's why a lot of them overdose.
And from what I have been told, that once they get that initial euphoric reaction, they are never able to recapture.
Right, that's true. They're never able to recapture that.
So
But they're trying.
Right.
Right. Yeah. Yes.
Tell me the reason why that happens is because they're putting something that's not pure into your system. Your body never been part of that before. So when it takes on that and it gives you that high, now your body is tainted, your blood system is tainted. so they'll never catch that again because it's not in its pure state of going into your system. That's
And then the way it's releasing the dopamine and stuff like that, you know, it's it's throwing everything off balance. And so every time you're introducing the drug back to your body, you know, you're throwing the whole system off, and then because you're doing it so much and so often, it's completely staying off all the time. There'll never be that balance, that chemical balance, until they completely stop. Sometimes it can be restored, but a lot of times it can't. So, other health effects of cocaine use: constricts the blood vessels, raise body temperature and blood pressure, fast or irregular heartbeats, tremors, and much muscle twitching, snorting. People that snort it, they lose loss of smell, nosebleeds, frequent runny nose, and problems with swelling in the nasal. People that smoke it, they start to have a cough. They can get asthma, respiratory distress, and high risk of infections like pneumonia. Consuming by mouth, severe bowel decay from reduced blood flow. So needle injection, higher risk of contracting HIV, hepatitis C, and other blood-borne diseases, skin and soft tissue infections, as well as scarring or collapsed veins. And some of the names for the cocaine is C, coke, crack, nose candy, snow, white lady, tooth, Charlie, blow, white dust, or stardust. And the reason I'm giving these names is so that if you hear these names, sometimes, especially with kids, you don't know what they're talking about, you know, you'll at least kind of be aware of what some of these names are. So if you hear them, then you need to investigate.
I think that's a good point that you're saying, because you can look at a kid's phone and it's a lot of stuff where they're talking in code,
Right.
and you're reading it, and you have no clue what they're talking about.
what do you say?
It's just like the commercial with the kids with the vapes, and it looks like a flash drive, you know, and it's crazy how these people are, you know, targeting our kids, and yeah, because a lot of it looked like candy. It's come in different flavors, especially now. A lot of the well, I don't want to get ahead of myself, but it's out there. Okay, which brings us to nicotine. So nicotine is a stimulant drug that speeds up the message traveling between the brain and body. Nicotine acts in the brain by stimulating the adrenal glands and releasing the hormone here we go. That name. Okay. And by increasing levels of chemical messengers, I'm sorry, say that again. Levels of chemical messenger dopamine. Nicotine can kill brain cells and stop new ones from forming in the hippocampus, a brain region involved in memory. That's a part of your brain that stores memory. So it kills brain cells and stops new ones from forming in that area of the brain. It is the main psychoactive ingredient in tobacco products. Tar and carbon monoxide are released when tobacco is burned, such as when it's smoked. Nicotine is a dangerous and highly addictive chemical. It can cause an increase in blood pressure, heart rate, flow of blood to the heart, and narrowing of arteries.
There's a question on Facebook coming in from Christine Jacob Combs with the question, what is the difference between coke and crack?
The way it's made. Cocaine is mainly in a powdered form, and the crack they add other stuff to it to and the way they cook it to harden it. So it's just the way it's made. And then a lot of those additives in the crack again can be, chemicals that are very dangerous also.
So why do they talk about crackheads like it's funny, like crackheads, but people that snort it, they don't get that same attention.
Well, I think, and this is where, when we look at the issues in our society based on socioeconomic status, with a lot of the cutting, a lot of the crack flooded the low economic areas. A lot of that pure powder was in the higher income, affluent areas of society. And so you can get someone, when you're looking at criminal justice reform, who had keys of cocaine on them would get less time than a person that had a couple of rocks in their pocket. And so this is where we go back to the 80s and 90s, where a lot of Black and brown individuals were imprisoned as a result of the war on drugs. But the justice was not, dealt out fairly. And so I think that's what the issue is. So where you're talking about, people talk about crackheads. I think it was because that was in the low income areas of society.
I think a lot of too, because of a lot of the additives that they had in the crack, caused them to become addicted much quicker than say someone that had the powdered form, and it goes into the body differently too. So if it's smoked, okay, it's going to get into your nervous system much quicker than it do when it's snorted.
But probably society looked down so much on a crackhead, as they call them, is because of all the things that the people that use did, as far as taking their rent money, spending it, So, why would you want to take your, food out of kids' mouth and, things like that, and don't take care of yourself, just look, any kind of way, So I think that's the whole joke of the matter, why they say crack here.
But I think when you look at abuse, abuse impacts every area of society. This is where people are talking about I'm drawing a blank on the one that's an epidemic right now.
Don't you think? No, it's an epidemic right now.
Okay, maybe that's the one I'm thinking. I come with another name. Opioids. Is that?
Okay.
Yeah. So when you look at the areas of society that the opioids are impacting, it is impacting areas where people are like, okay, now these chickens are coming home to roost, and it's becoming a problem for people. But addiction does not have a gender, it does not have an ethnicity. I really go back to the 80s when crack hit, it hit hard and it hit the low income areas. But now you're seeing a lot of these homeless people who have drug addictions are coming from families that are trying to, what's going on with my son or daughter? Why are they wanting to sleep under an underpass as opposed to in their bed? It's the same thing as what we saw with the crackheads, because they've been taken over by addiction. And now, society's starting to see we have to think of better ways of treating this condition in terms of how it impacts society and its people.
issue. A lot of times, you know, in the past, you know, it was, you know, it's it's a low income problem, you know, it's this, it's that. But now that it's affecting the people of higher income, you know, it because they could spend it and not affect their income to where they're taking the rent money and, you know what I'm saying, and things like this until it becomes a problem, you know. And so and when it becomes a problem, it could be years, it could be 5, 10 years down the road versus someone on crack, it's going to probably be a year or two because that, you know, if you're taking $10 off your rent money, smoking it every month, you know, that you short that every month, and it's going to affect your, you know, your living. So versus someone else who they could be, if they're using the powder form and they use it maybe $100 or whatever, it might not be affecting their income right away because they have that money to burn, should I say. Yeah, to answer that question is the way it's processed. So going back to the nicotine may also contribute to the hardening of artery walls, which is in turn may lead to a heart attack. Secondhand smoke can lead to lung cancer and heart disease, as well as other health effects in adults and children. Street names for cigarettes are cigs, darts, rollies, smokes, bags, butts, cancer sticks. So now we know that they didn't till a few years ago start having to put all these warnings on on the packages of cigarettes and stuff because it becomes such a medical issue. And it was wearing down the medical field, and you know, with all these people coming out with cancer and all this other stuff. So now you have to put these warning signs, and so, but they're still targeting our youth. That's part of it.
I have a question, and you probably won't be able to speak to this, but I find it interesting how the government really targets nicotine, and like you said, it's bad, 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 but they're really embracing marijuana at this point, where it's very odd to me. Like, you know, they'll condemn one, but they're all open for the other one. Your thoughts on that?
And they're both wrong. Hurtful to the body.
You know, and they talk about, you know, medicinal purposes for the marijuana. Yeah, there are medicinal purposes, but it's just the CBD that's in the marijuana. Marijuana, which we'll get to later, has so many components to it that it's kind of mind-blowing. But that's only one thing. There's so many ways that they could use that. They could take the CBD in a pill form and do the same thing to help with the nausea and cancer patients and different things that they're saying that this is for. But, you know, they're pushing for the whole thing. Let's legalize it all, you know. We're the whole plant, not just the portion of it that we can use, you know. Just like when you get to your pain medications and stuff like that, you know what I'm saying? There's some that's beneficial, you know, but where they're getting it from, they're not using that whole plant, you know what I'm saying, unless it's being illegally used.
Now, God put these plants on this earth, right?
We did that.
So, did he put those plants, here's some of the plants, like the coke and all that. Were those for us to use to benefit us, or we're abusing it? But I'm just saying, is it for us to use to help us with problems like arthritis and this or that? You know what I'm saying?
So what I would say things can be used for good, but I think it becomes a problem when you make it an idol or a god. So if you're looking at, we're really talking about substance abuse addiction. As you were saying, people were willing to take their rent money, their grocery money, and as opposed to paying their rent or their mortgage or feeding their kids, they were feeding a habit. And so we have to ask ourselves, is God in us making decisions that go against being productive members of society, going against offering him the praise? I think it becomes an issue, and I think addiction is another word that we can say is idol worship. When you're putting something above and beyond God and your divine purpose, you have entered dangerous territory. And I know a lot of people love to say, oh, God made the tree and this is good for me. But when it really becomes a problem that's destroying homes and families, then we can definitely say God is not in that behavior.
And because we're not using it for its created purpose, when we're abusing drugs or anything that that we abuse. Because it's not just drugs that we abuse, but
a lot of plants and things in the world
right.
that I know God made, but and it's not good for us to
Right.
eat it or something, So.
Right. To experimenting with stuff. They take it out of context.
It's like a monster.
So there is a couple of comments that have come
Okay.
from B12, discipline versus undisciplined. We have to make a choice before addiction sets in. And from Darlene Atlas Carter, some may say he gave Adam the permission to eat all the plants except one. How do you explain that to the young looking for excuses?
Trees for them to eat of except for one. So trees and plants are two different things. Trees bear fruit. Most of these plants bear flowers. So, I mean, we don't go around picking flowers and smoking them and stuff like that normally, right? And then if it's a tree, we're going to get the fruit, not the leaves. How do we explain that to kids? There, trees that bear fruit. So they ate the fruit that was on the trees, not the leaves. That's probably how I would explain it. I don't know. Does anyone have any other?
Well, I think it goes back to that second component where she's saying people are looking for excuses. And people will look to justify any problematic behavior. A person who's going to cheat on their wife will blame their wife for them cheating as opposed to the fact that they made that choice to cheat on their wife. And I think we, as believers, do ourselves a disservice to get into arguments with people who are just not making that choice to choose this day who they're going to serve. Our goal is to show them Christ, to love on them, to let them know the behavior you're engaging in is wrong. But God loves you. He cares for you. You can overcome this. But I think it gets to, like I said last week, they need that prodigal son experience where they wake up in the chicken coop, kind of like Smokey and Friday. That's kind of how I envision, the prodigal son was in there like Smokey from Friday in the chicken coop with the twitch, realizing there's more to life than smoking this blunt, snorting these lines, ingesting these diseases, these drugs, because we see people die regularly, especially young people. They do dumb stuff. There's people alcohol poisoning because they want to take the alcohol through their rectum as opposed to drinking it. People have died from this stuff. And it's sad, but it goes on.
And using alcohol like that? Oh, geez.
Like you said, kids do a lot of dumb stuff, and a lot of times it costs their life.
Get it going, each other.
Mm-hmm. Yeah. And to, I believe it was Phoebe, her comment, yeah, so people, it's unfortunate that, we want to try all these different things and we want to follow the crowd and fit in, and sometimes it's just that doing it that one time for some people, and if you have substance abuse in your family, you're at a higher risk of becoming an addict yourself. So it's important that, curiosity killed the cat. And that's why a lot of people are dead today, And so not taking that first hit, not using those drugs, in the first place is important, And if you try it once, learn from that and move on. Don't go back a second, third, fourth time, because you never know where it's going to lead you. Just because you might know one person that used it occasionally and socially doesn't mean that'll be the case for you. So it's important to, not even go there in the first place.
And I think that's also a good point that I think a lot of people forget. Everyone's body chemistry is different. And this gets into what we were discussing last week. We can't take our medications and give them to somebody else and tell them, oh, you got this back pain here, take this, this is what my doctor gave me, because we don't know their chart. So we have to be careful.
Which brings us to methamphetamine. It's also another one that's wreaking havoc for years throughout our community, especially those with low income. So methamphetamine, the base drug in there is amphetamine, which I was saying earlier, amphetamine is found in a lot of your cold medications. They are psychostimulant drugs, which means they speed up the message traveling between the brain and the body. So if you notice, most of these are all speeding up the messages that travels between the brain and the body. And some amphetamines are legally prescribed by doctors to treat attention deficit disorder, narcolepsy, an uncontrollable urge to sleep, and Parkinson's disease. Amphetamines have also been taken as performance enhancement drugs. Methamphetamine is a man-made stimulant that's been around for years. Meth was given to soldiers during World War II to keep them awake. People have taken drugs to lose weight and ease depression. Research demonstrates an association between amphetamine use and the increased violent behavior. Snorting amphetamine can damage the nasal passage and cause nosebleed. Injecting the drug may increase risks of determinous infections, vein damage, and blood clots. Meth makes a user's body temperature rise so high they can pass out or even die. A user can feel anxious, confused, inability to sleep, mood swings, and become violent. So a lot of times people that take meth, they could be up for days. And a lot of people that's working these graveyard shifts in these warehouses is taking meth to stay awoke.
Then I also think when you look at the physical transformation of people that use meth, like their mouth and their face, it's just really scary. They really become like the Night of the Living Dead.
Yeah. I don't know if you guys see some of this. It's called meth mouth.
Meth mouth?
Yes, because it destroys your teeth.
Oh.
Yes, it destroys your teeth really bad. So users may change radically, aging more quickly, skin may dull, develop heart to heal sores and pimples, experience dry mouth, stained, broken, and or rotting teeth.
There's a comment
Mhm.
in the chat about doctors prescribing some of these drugs to children so they will sit still in class.
Yes, and that's where we attention deficit disorder. We talked about that earlier. It is prescribed. I think it's the word for attention deficit disorder because the way it in children, the way it reacts can be different than adults. So it can slow them down versus speeding others up.
Really? It was the kid though?
Well, they prescribe it, so I'm assuming not. Yeah, but it is a yes, definitely prescribed to by doctors to treat attention deficit disorder. So meth is manufactured in illegal laboratories. The cook used different cold medicines as the base of the production of the drug.
Cold motion.
Yeah. That's why if you notice when you go to the store now, it used to be you can go and buy what is it called Sudafed, Actifed. I remember back in the day I used to have really bad allergies, and the only thing that would help me is the Sudafed and the Actifed. And I would go and, because keep them running back and forth, I get 2 boxes of each, did it for years. And one day I went into the store and it was like, oh, you can only buy one. I'm like, what? Yeah, it's because people were coming in there buying all this stuff off the shelves to make the meth. So they started putting stipulations on it. So the ingredients are extracted from the peels to increase its strength and is combined with chemicals such as battery acid, drain cleaner, lantern fuel, and antifreeze.
Okay.
Yes. Yeah.
I guess the question you have to say, when you know all of this is in this stuff, why are you putting this poison in your body?
Right.
But a lot of people don't know that that's what they're inhaling or ingesting.
Yeah. They don't know. So the ability of the central nervous system is regenerated through neurons is limited. And in many cases, the loss of neurons cannot be recovered. Neural death occurs, in a number of areas of the brain as a result of meth abuse. That includes, but not limited to, the hippocampus, sorry, I cannot pronounce half these words. I've even looked them up and did the pronunciation, and I still can't get it out. You all forgive me. The parental cortex, the frontal and prefrontal cortex, the cerebellum. So these are all just different parts of the brain that are affected by the methamphetamine. And it kills your brain cells. And even though, it talks about the brain cells and stuff like that, you just got to imagine if you're putting all this stuff into your body, what it's doing to other parts of your body, to your digestive system, to your veins in different areas also, not to mention your heart, liver, lungs, kidneys. Okay, prescription medications. So dextroamphetamine is a central nervous system stimulant and an amphetamine inhibitor that is prescribed for the treatment of attention deficit disorder. Okay, so again, when we talked about that earlier, the amphetamine part of the drug is what's prescribed. It works by changing the amount of certain natural substances in the brain. It helps by increasing the activity of the brain's chemical dopamine and norepinephrine, which helps you to pay attention, stay focused on an activity, and control behavior problems. It is also used to help you organize your tasks and improve listening skills. This medication is also used to treat a certain narcolepsy by helping you stay awoke during the day. Dopamine is involved in the reinforcement of rewarding behavior. Norepinephrine affects blood vessels, blood pressure, and heart rate, blood sugar, and breathing. It should not be used to treat tiredness or to hold off sleep in people who do not have a sleep disorder. Modafinil is a waking drug prescribed to narcolepsy patients, enhance their alertness, or to mitigate fatigue. This study was conducted to investigate practical use and toxic effects on the neuroimmune interaction of polyphenol. So other stimulant prescription brand names is Ritalin, Conturina, Dexedrine, and Fentanyl. Street names is Arbol, Vitamin R, Speed, Black Beauty, Skippy, Kibbles and Bits, Truck Drivers, Crosses, LA Turnaround, Jif, Uppers, Bennies, and Hearts. Effects of stimulants. People who does not have attention deficit disorder and take stimulants, it floods the brain with dopamine, causing an overload in the brain, and instead of having a calming effect, it disrupts the brain's communication, changing how emotions are regulated. They experience hallucinogens, thinking, delusional thinking, panic attacks, severe anxiety, mania, and paranoia. Physically, it raises the blood pressure, body temperature, heart rate, and keeping users awake and suppresses the appetite.
One thing I think it's also important just seeing all of the impacts that these drugs have on the body. I think a lot of times people go to the doctors, or even they come to pastors and elders to pray for them, and we do know God is a healer. But a lot of times, because of the damage people have inflicted on their body when they get older in age, and there's other medications or things in which doctors would try to use to treat them, it does not work because a lot of the damage by some of the stuff that people have put into their body.
We have to remember that our body is the temple of the Holy Spirit, and we should not be engaging in any of these illegal drugs. We should not be taking other people's prescription medications. If we have issues, I mean, I'm guilty of it back in the day. But, you know, if we have issues, we need to get to the doctor and get proper treatment. So it's important that we do. So depressants. So those were the stimulants. So the depressants are barbiturates, GHB, rohypnol, benzodiazepine, and alcohol. And because of the time, I'm going to try to, we still have some more to get through. Take too much time on the stimulants. So depressants affect the central nervous system. These medication drugs can lower neurotransmitter levels and slow brain activity, making them useful for treating anxiety, panic, acute stress reactions, and sleep disorders. Tolerance can develop rapidly, needing larger doses to obtain the same result. Higher doses can cause diminishing memory, judgment and coordination, irritability, paranoia, and suicidal thoughts. Or the opposite effect can happen, like agitation and aggression. Drugs that are classified as depressants include GHB, barbiturates, rohypnol, and benzodiazepines.
No, one of the rohypnol was like Jackson was taking that killed him.
No, it wasn't the rohypnol. It was the
Close enough.
propanol, yeah, which was kind of do something like what the rohypnol does. Okay, so the GHB or gamma hydroxybutyrate is a central nervous system depressant. It is referred to as the date rape drug. It is naturally made in the human body in very small quantities. When taken recreationally and especially in combination with alcohol or other drugs, it can be extremely dangerous. GHB can be placed in alcohol or other beverages. I'm going to stop right there on this one.
I do think, just in terms of if you have young daughters, even son, the best advice you can give them is if they leave a drink, don't drink back from it. Don't drink a drink that you did not see anyone pour it in yourself, because someone can always slip something.
When it comes to this particular drug, that's why they call it the date rape drug, because it will basically paralyze you, and then it also will wipe some of your memory away too. So they could get up the next day, will have been raped, but they don't remember. They don't remember it. So it's important that excellent advice, Pastor Carter. That's what I tell. I know my son went to a party at one of his friends the other day, and I'm like, okay, after doing all this studying and stuff, and I'm like, okay, make sure when you go, if you walk away from your drink, do not drink it again. Don't drink after nobody else, and I'm just running it all down to them and stuff. I'm like, I don't mean to be paranoid, but we really need to be teaching this to our children. I know a young lady years ago went to a club and someone had put something in her drink, and smart young lady. I believe she was working at Patton State Hospital at the time, and after that, she was no good no more. Yeah. So it's important that, everybody ain't for you. Everybody's not good people. So, make sure that you be watchful. Yeah.
That's a close friend too. A close friend did it. Yeah.
Barbiturates. Barbiturates are synthetic drugs used in medicine to depress the central nervous system. It is a sedative hypnotic used to treat insomnia, seizures, and headache. Barbiturates are also used in a hospital setting for operative sedation anesthesia. Some barbiturates are used to relieve tension or anxiety prior to surgery. The effects range from mild sedation to coma. People who develop a tolerance, which means that they need higher and more frequent doses of the drug to get the desired effect, as addiction develops when continued use of the drug leads to negative consequences, such as health problems or failure to meet obligations at work, school, or home. Continued use of the drug, people addicted to prescriptions, the CNS depressant should not try to stop taking them on their own. Withdrawal symptoms from these drugs may be severe and potentially life-threatening. Okay, so if you become addicted to barbiturates, that's not something you want to detox on your own. A lot of these drugs, when you're trying to get off of them, it's better to get into a detox treatment center or someplace so that you can do it safely.
I think that point you're making kind of gets into what we were discussing last week about proper treatment will be a combination of spiritual as well as professional. So,
It's really important, especially with because you don't know how your body's going to react when you start trying to come off the drugs, and you've been introducing these chemicals to your body for so long, and then just to stop, can throw your body into shock. So it's important that you do it safely.
Can you tell me what a what's the name or what is?
Um,
What the drug is? What kind of drugs are they?
it's a depressant drug.
It's a depressant drug. In like what, like so like an aspirin or is it barbiturate?
Yeah, it's, or it should
you're talking about like street names or like brand names.
Whatever it is, whatever it is. Barbiturates. What are they?
Well,
What do they fall under? Like
So it's like
a stimulant or
a depressant.
it's a
So
depressant.
it depresses your central nervous system.
It's just system.
Luminol, Bravato, Decanol, and Butisol are down.
But it's to help depress the pain, right? Is it for pain? Are they for pain? I've heard that word, barbiturates, but I didn't know what class they're in, and what are they used for? But she said to depress your nervous system.
To treat anxiety and to induce sleep.
Oh, for anxiety. Okay, then okay.
Sedation, anxiety, and amnesia.
And
I'm sorry, I'm on the wrong slide. I'm getting the wrong information. But it's for insomnia, seizures, and headaches. So like migraine headaches,
like an aspirin.
kind of, sort of, not really.
Um,
Okay, benzodiazepines. Benzodiazepines are depressants that slow down the central nervous system and produce sedation, hypnosis, relieves anxiety and muscle spasms, and reduce seizures. Alprazolam is the only high-potency benzodiazepine developed to treat panic disorders, with the goal of eliminating panic attacks and restoring normal function. It is utilized for sedation, anxiety, and amnesia in critical care settings and prior to anesthesia. So it's available in the United States in an injectable preparation as a syrup for pediatric patients. Benzodiazepine is a long duration of action and utilized to treat insomnia in patients with daytime insomnia. Benzodiazepines are associated with amnesia, hostility, irritability, and vivid or disturbed dreams.
That's not like a psych drug.
Yeah, but well, if you can get some um, those things like the vivid, and disturbing dreams and stuff like that with it, but it's mainly a depressant. Okay, so abuse is particularly high among heroin and cocaine users. Additionally, opiate users often co-abuse benzodiazepines to enhance euphoria. So it gives you like a added boost to your high. Benzodiazepines are only legally available through prescription. Many users may maintain their drug supply by getting prescriptions from several doctors, foregoing prescriptions or buying them illegally. So alprazolam and clonazepam are the two most frequently encountered benzodiazepines on the illicit market. What are common street names? Okay, so mainly the clonazepam, excuse me, is a very common benzo. And a lot of times you'll see that people that are addicted will use different types of drugs to enhance their high. So like it was saying, the people that use heroin will use the benzo, and then people that use cocaine, they tend to use alcohol with it. So it's like, they're gonna, because they can't get that first effect, they're still trying to chase that high, and they're trying to use other things with it to help them to get what they're trying to attain.
Right. So that's why people drink and do crack or heroin or whatever. That's to get that high between. Stay that between it.
Right. So rohypnol is a central nervous system depressant, and it is intermediate action benzodiazepine, a tranquilizer that is 10 times more potent than Valium. So, or it is used for short-term treatment of insomnia as a pre-medication in surgical procedures and for anesthesia. And as you know, people will abuse whatever they can get their hands on, right? So this is mainly for anesthesia, and it's a tranquilizer to put you to sleep. So I'm just gonna kind of skip through this.
It's kind of intriguing, like that people will abuse some of these things. Like, I don't quite get it.
Pastor, I think when people, and this is a small because I've been on drugs before, and why I use is because of my past, things that had happened in my past, and I was trying to suppress it and not deal with the pain and the hurt that I had, been through. So that's why basically I use them, but I don't know why other people that has a good job and got this silver spoon in their mouth, what's their problem? You know what I'm saying? They got no problem. They got money. They got big houses. They got good jobs. You know what I'm saying? But they want to use.
But I think when you kind of look at different categories, and we talked about the stimulants, which is kind of get you more upbeat, but some of these drugs that are to get you down, just kind of, yes, just kind of odd.
That high, that upper, looking at that speed. It's like, I'm chilling with it. You know what I'm saying?
So I guess a question I have, when you see those, like I said, those people that are going like 1,000 hours a second or a minute, is that a sign that they're on drugs, or is it that could like naturally be like that high, if you will?
For some people, it is natural. Very few, but it's for some people it get, yeah.
To be.
Yeah.
And all
When
that
you talk about people that has ADHD and stuff like that, yes, ma'am.
Oh,
The chemicals in the brains is out of balance. And so, yeah, and that's where they're given certain medications to help calm them down. Now, some of the same medications that would help calm a person that, say, have ADHD down, a person that don't have it is going to speed them up. Right, exactly.
I remember being in high school and having a teacher, and this individual was all over the place, and they had so much energy, and I really couldn't understand what they were saying because they were going so fast.
but these new kids now, they talk fast like that. And what did you say? I didn't understand what you said. They just talk that fast. This new thing. I'm like, wow, that's crazy. They had no drugs. It was just so fast.
Okay, so let's talk about the hallucinogens right quick. Hallucinogens are sensory experiences that appear real but are created by the mind. A false perception of reality. It can affect all 5 of your senses. For example, you might hear a voice that no one else in the room can hear, or see an image that isn't real. Neuropsychologist Professor Xavier Walters from the University of Western Australia that hallucinogens are caused when something goes wrong in the relationship between the brain's frontal lobe and the sensory cortex. The research professor Walter said, auditory hallucinations experienced by people with schizophrenia involve an overactive auditory cortex, the part of the brain that processes sound. This results in random sounds and speech fragments being generated. People with Parkinson's disease appear to have an overactive visual cortex, which results in images being generated in their brain of things that aren't actually there. Psychoactive drugs upset the relationship between the sense processing parts of the brain and the frontal lobe in a similar way. It allows the processing of images and sounds that would normally be inhibited. Being drunk or high or coming down from such drugs like marijuana, LSD, cocaine, including crack, PCP, amphetamine, heroin, ketamine, and alcohol also increase hallucinations. Excuse me. Okay, so ketamine, LSD, PCP, and marijuana are all hallucinogens.
From Darlene Atlas Carter, it's crazy that they're trying to legalize drugs.
Yes, it is crazy. We got enough people walking down the street talking at the light pole. It will increase. So ketamine, and I brought this only because it's ketamine is a surgical, dissociative anesthetic. It also produces particular hallucinogenic effects. It works by disrupting the central nervous system and inducing a catatonic state. Ketamine is a sedative that causes immobility, relief from pain, and amnesia. The effects happen within a few minutes. It produces hallucinations, that can last 30 to 60 minutes. Ketamine works fast and briefly takes over certain chemical receptors in the brain. During the Vietnam War, it was used as an anesthesia and painkiller. Ketamine is used commonly by veterinarians for surgical procedures, resistant sedation, pain, and/or anesthesia for animals. When abused, ketamine can alter your sense of sight and sound, cause you to feel out of touch with your surroundings and yourself, make it hard to speak or move. It has also been used as a daybreak drug. It can leave someone who is high on ketamine in a terrifying state known as a K-hole. Common street names include Kit Kat, Special K, Super Acid, Super K, Vitamin K, and Special Lacote. So this drug is mainly for sedating animals. Okay, next we have another hard name, especially known as LSD. So it's an odorless, colorless substance known for its highly potent psychedelic effect. And we know a lot of LSD was used in the 60s. It intermingles with proteins on the surface of brain cells called serotonin receptors. Serotonin is a chemical messenger that helps brain cells communicate. LSD affects the brain's serotonin levels, causing a decrease in communication among brain areas where the planning and decision making are made. Increased communications where sensations and movements are made and alter thinking and perception. Users can experience hallucinations, seeing things that are not there. Colors, sounds, and objects are distorted. Time may seem to speed up or slow down, producing mood elevating trips. They may also alter thoughts, feelings, and awareness of one's surroundings. Many users have visual or auditory hallucinations. Dilated pupils, increased blood pressure, and increased body temperature are typical. People who regularly use LSD may eventually experience flashbacks. A flashback is when an LSD experience reoccurs, typically visual distortion that involves changes in perception or emotion. Flashback can happen weeks to months or years after the last use of the drug. So LSD is commonly orally in powder, liquid, or pill form and is abused by individuals in their late teens and early 20s. And LSD can be put on, like they put it on like little stickers and stuff like that, and you just lick it or touch it and put it in your hand. It's very highly absorbed. And
I can see Mickey Mouse playing on the ground. I'm in the bathroom, right? And I was sitting there, and all of a sudden, they just came up. Mickey Mouse, and they were just playing. I was sitting there just laughing. Yes. And that's the last time I did it.
Okay, PCP. PCP affects multiple neurotransmitter systems in the brain. It inhibits the reuptake of dopamine, norepinephrine, and serotonin. It also inhibits the action of glutamate by blocking NMDA receptors, which are responsible for pain, sensation, emotion, learning, and memory. PCP was developed in the 1950s as an anesthetic. However, PCP as an anesthetic was dropped after some people experienced psychoactive reactions after using the drug. PCP is classified as a dissociative and anesthetic because users appear to be disconnected from their environment. They know where they are, but they do not feel as if they are part of it. Yeah. PCP also causes slurred speech, issues with walking and motor coordination, euphoria, giddiness, and bloodshot eyes. Individuals under the effect of lower doses will also experience hallucinations, aggressiveness, and dissociative effects. Heavy doses of PCP are associated with an exacerbation of all the above mentioned effects, but they can also cause coma and catatonic state. It may also result in life-threatening seizures. PCP affect the neurotransmitter and the NMDA in an area of the brain known as the hippocampus. This leads to an ability to encode information, long-term memory. Long-term use of PCP damages the neurons that perform these functions, later having issues with memory, even when the drug is not being used. So again, affects the hippocampus where it affects your
That's
memory.
in the brain, right?
Yes.
Hippocampus.
Yes. Or the brain. Okay. Okay, marijuana. It comes from the hemp plant, and marijuana. The hemp and marijuana plant are made up of compounds known as cannabinoids. Cannabis has over 400 known compounds in the plant, of which around 150 have been recognized as cannabinoids. The most commonly recognized cannabinoids are THC and CBD due to their properties. Cannabinoids from the hemp plant are mainly CBD. CBD has been studied for its therapeutic effects on the body, which does not create the high like the THC. Again, that's when we go back to people with cancer and different that needs the marijuana for medicinal purposes. If they use the CBD, they don't get the high, but they still get the therapeutic effects. But most people want the whole thing. So the THC produces feelings of euphoria and relaxation, as well as temporary lack of memory and attention. It is able to attach to molecules called cannabinoid receptors on neurons in the brain and activate them, disrupting various mental and physical functions and alter normal brain communication. THC is able to alter the functioning of the hippocampus and to the orbital frontal lobe cortex, brain areas that enable a person to form new memories and shift his or her attention focus. As a result, using marijuana causes impaired thinking and interferes with a person's ability to learn and perform complicated tasks. Cannabis has also been associated with an increase in mental illness, especially schizophrenia and depression.
Legalize marijuana.
Remember, it's a hallucination. A lot of people that have schizophrenia, hallucinates, right? Okay, narcotic analgesics, which is your pain medication. Narcotic analgesics Gilesics are the foundation of the treatment of pain in patients with decrease that cause severe pain. Diseases, I'm sorry, that cause severe pain. They usually are the second step in pain relief after non-narcotic analgesics have surpassed their effectiveness. Narcotics are also called opiate pain relievers. They are only used for pain that is severe and is not helped by other types of painkillers. When used under the care of a health provider, these drugs can be effective at reducing pain. Opiate drugs bind to opiate receptors in the brain, spinal cord, and other areas of the body, telling the brain that you are not in pain. Opiates are a type of narcotic pain medication. For people who have an opiate addiction, their problems often start with a prescription. So your narcotic analgesics are heroin, morphine, oxycontin, or oxycodone, fentanyl. Norcos, yeah. Norcos fall under that also. I just didn't, I had to stop it somewhere.
Can you please give me those names again?
Heroin, morphine, fentanyl, oxycontin, and oxycodone. So oxycontin and oxycodone. It is a time-release version of oxycontin is a time-release version of oxycodone, which is a quick release. So if you're prescribed oxycodone, it's for immediate pain relief. And so sometimes they will, depending on what your disease you have, they might prescribe both. One that you would take, like if you were in acute pain, you would take one, and then they probably would have you 4 to 6 hours later, take the other one, and that's a longer acting. So it releases itself slowly in the bloodstream throughout the day. So oxycontin should be swallowed whole. Do not break, crush, or dissolve the tablet. And when they get into abuse, this is what they end up doing with the crushing them, snorting them, everything. Doing so can increase the risk of oxycodone overdose. Opiate medication slows down or stops your breathing, and death may occur. So a person caring for you should seek emergency medical attention if you have slow breathing with long pauses, blue-colored lips, or if you are hard to wake up. So if you're caring for someone that are on these medications and stuff like that, you want to make sure that you kind of always observe their breathing and stuff like that. Or even if, they're sleeping too long and stuff like that, you want to make sure that you be aware, of that. Because now they have what's called Narcan that they give people that are on these medications. And what it does, it will bring them right to where they, it'll bring them back if they're, slow, and then you want to call 911 immediately. For overdose, that's what it is, for overdose. And it's easily when you're on these pain medications, because even though they're pain medications, they're still doing things in your brain just like the other drugs are doing. And so you could easily take too many or anything. So it's important to be careful with it. And then also you have to properly stop taking these medications as directed. Okay, so street names for Oxycontin include OC, Kicker, Oxycontin, and Hillbilly Heroin. Okay, heroin. Heroin is a very addictive drug made from morphine, a psychoactive substance taken from the resin of the seed pods in the opium poppy plant. It can be white or brown powder, or a black sticky substance called black tar heroin. Heroin enters the brain rapidly and binds to opiate receptors on the cells located in the brain and on the receptor involving feelings of pain, pleasure, controlling the heart rate, sleeping, and breathing. Heroin is highly addictive, and people with regular use who regularly use heroin often develop a tolerance, which means they need higher doses and use more frequently to get the desired effect. Those who are addicted to heroin and stop the drug suddenly may have severe withdrawals. Heroin often contains additives such as sugar, starch, or powdered milk that can clog blood vessels, leading to the lungs, liver, kidneys, or brain, causing permanent damage. Sharing drug injection paraphernalia can increase the risk of coming down with infectious disease like HIV or hepatitis. Okay, so again, highly addictive. It's the street form of morphine. Okay, and a lot of times people that are on these pain medications, and you'll find like a lot of kids that have sports injuries and stuff, they will give those to kids. And then after they've been on them for a while and they become addicted to them, then they take them away. And it's like they're addicted. So what do? They're going to go to the streets buying pills, or the majority of them turn to heroin because it's cheaper. Okay. Morphine. Morphine is a medication used to treat short-term management of chronic, moderate to severe pain. It belongs to a class of drugs known as opiate analgesic. Morphine is a central nervous system depressant that is very dangerous to combine with other central nervous system depressants. Morphine works in the brain to change how the body feels and responds to pain. It binds to opiate receptors, blocking the transmission of neuroreceptor signals pain, modulating neurons in the spinal cord, and have its primary effort to the sensory projection cells. Excess consumption of morphine and other opiates lead to change in symptomatic neuroplasticity, including changes in neuron density, changes in post-lymphatic sites, and change in the remic terminals. Morphine is the main alkaloid of morphine, provide a feeling, I think I skipped this, of opium, was first obtained from poppy seeds in 1805. Morphine is named after Morpheus, the Greek god of dreams. Okay, and so in some cases, morphine can even be smoked. More than half of accidental drug deaths in the U.S. is caused by heroin or morphine. Okay, we still got one more section to get to. So fentanyl. Fentanyl is a powdered synthetic opiate analgesic that is similar to morphine, but is 50 to 100 times more potent. It is used to treat patients with severe pain or to manage pain after surgery. It is also sometimes used to treat patients with chronic pain who are physically tolerant to other opiates. So again, the fentanyl is very highly addictive, and it is highly potent. So it's 50 to 100 times more potent than the other opiate pain medications. And right now, we've been finding it coming up in other drugs. So like if you buy say you buy an Oxycontin or Norcos or something off the street. They're cutting it with the fentanyl because the fentanyl right now is, they're getting it from China and it's much cheaper. And so it's flooding over this way and they're cutting it with all these other things. And it's highly addictive. So it's going to keep you coming back for more and more. So it only takes a little bit to kill a person. Yeah, that's what a lot of, there's been a lot of deaths of a lot of the kids, teenagers and early 20s and stuff that's dying from the fentanyl. Okay, we're down to the inhalants. They got packed a lot in this. Okay, so inhalants are easily bought and found in the home or workplace. Spray paint, markers, glue, and cleaning fluid. People don't typically think of these products as drugs because they're not intended to get for getting high, but some people use them for that purpose. When these substances are used for getting high, they are called inhalants. People who use inhalants breathe in the fumes through their nose or mouth, usually by sniffing, snorting, gagging, or huffing. Although the high that inhalants produce usually lasts a few minutes, people often try to make it last by inhaling again and again for several hours. Most inhalant affects the central nervous system and slows down the brain activity. With repeated inhalations, many may feel less self-conscious and less in control. Unlike other types of inhalants, nitrates, which are often prescribed to treat chest pain, are misused in order to improve sexual pleasure by expanding and relaxing blood vessels. Many solvents and aerosol sprays are highly concentrated, meaning they contain a large amount of chemicals with a lot of active ingredients. Sniffing these products can cause the heart to stop within minutes. This condition, known as sudden sniffing death, can happen to otherwise healthy young people the first time they use an inhalant. Using inhalant with a paper or plastic bag in a closed area can cause death from suffocation. So a lot of your inhalants are stuff that you can find under this kitchen sink. Any liquids that evaporate at room temperature. So like your paint thinners, different things like that. So thinners.
I have a question, because I was, the way you said things that are under the kitchen sink, and I was curious. You said paint thinners and some of this other stuff. Do people inhale like bug spray?
Yes. Yes. Bug spray. What's under the kitchen sink? Drano. Sometimes we, keeps the bleach. Yes, they sniff it off.
I'm asking my son right now because he encountered a situation the other day with this young girl, and she was snorting out of a can or something. Huffing, he's called
Huffing?
Huffing or something. But I'm trying to ask him the name because he told me it was something else, I think. But he said she was hitting that stuff, snorting. He's acting just weird. Yeah. She passed out. And, yeah, it's crazy. A blue girl? Oh,
yeah, when I was at home, I had to monitor the kids. So that's why the child was not doing it right. And I said, you're not inhaling that, right? I'm trying to get high. I'll be getting high on my watch. see, there you go, there you go. I said, no. I said, let me tell you a secret. I be saying, hey, Richard, so I know what you're doing. I made him deflate all the air out of his lungs. And he had no other choice but to inhale it right. Oh, here you go.
And hold it. And hold it.
Yeah, but see, when you're full, you can't get it in it, so it's going to go
Go your
up.
brain, right.
And that's what's going to keep us so
Oh my God, that's good.
Right. So the thinner sniffing causes damage to the brain, kidneys, liver, lung, and reproductive system. So examples is paint thinner and remover, dry cleaning fluids, degreasers, and gasoline glues. Corrective fluid, like the white stuff that you use to when you gotta yes, felt tip marker fluid, and electronic contact cleaner. So gases. Inhaling gases may cause a general body positioning, including breathing difficulty. They are poisonous to the body's cells because they displace oxygen in the body and therefore limits the amount of oxygen reaching the tissues. So yeah, gases include household or chemical products such as butane from lighters, propane from gas grills and cooking system fluid, and medical anesthetic gases such as ether, chloroform, halogen, and nitrous oxide. Yeah, it's a lot. So aerosols. Aerosols are sprays that contain propellant and solvents. They also contain chemicals like formaldehyde and the exhalate. These ingredients are carcinogenic and neurotoxin, harmful to the body, children and pets. Once on surfaces, these toxins can get on your hands, and from there, of course, they can get into the mouth. Abusers can sniff or snort fumes from spray aerosol containers directly into the nose or mouth. Puff fumes from the inhalant soaked. Aerosols include spray paint, deodorant, and hairspray, vegetable oil spray for cooking, and fabric protector sprays, paint thinners, degreasers, and insecticides. Nitrates. Okay, so nitrates are an organic compound made up of nitrogen and oxygen, part of the nitrogens and 3-part oxygen. Actually, I'm going to go ahead and stop here. I just wanted to get time for us to go through our quiz. Probably dynamite. There's gunpowder.
I'm still floored that people are running around sniffing bug spray.
I got floored when I found out they was using a spray to clean the to clean the computer keyboard with dust. Yeah, the dust spray. That tripped me out. I'm like, did anyone have any questions? I know we've been kind of going through.
What about
Helium? Yeah, that's the nitrous oxide that I mentioned. Or they call it, then there's the laughing gas too. But helium definitely. Okay, let's go to our test. So what is the most common stimulant used in the world?
caffeine?
Caffeine. And cocaine is an ingredient in Coca-Cola's original recipe. It's true. What is the most common depressant used in the world?
A.
The alcohol.
B.
Alcohol, yeah.
That's 3 of them.
Sugar can contribute to depression.
F.
That's true.
It's true.
Oh, true.
Oh,
What is the most common hallucinogen used in the world?
A.
PCP?
A.
Everybody agree?
B.
What was the op-
There's PCP, mescaline, LSD, and magic mushrooms. LSD.
LSD.
C.
Mhm. Bath salt is a hallucinogen. True or false? True.
Oh,
Is that the one where they said the dude in Florida took it and started going around biting people?
Yes. Yeah. Bath salt that you put in your bathtub? Yes.
it makes you hallucinate
Yes, ma'am.
That's all.
if you ingest it.
Yes.
Oh,
Yes, yes, yes.
wow.
People were taking everything.
That's, golly, that's desperate. That's desperate stuff.
What is the most common narcotic used in the world?
B.
It's actually D, opium. Americans consume 80% of prescription narcotics in the world. True or false? True. We use more prescription medication than anywhere in the world. Okay, what is the most common inhalant used in the world? C. C, paint thinner.
Really?
Yeah. And the last question, air dust is a commonly abused inhalant. True or false? That is true.
I did see that plan.
But some of the other things was, what's that? When I asked, oh, sugar, the sugar, yeah. How was that? Something depressant. Sugar does something to depressant. I can't make out what that word is. It's number, I can't see what number it is. I think it's number 4. Yeah, because I can't see what that word is. Number 4. It says
Contribute.
Well, I think that's kind of also when you look at people that have those sugar crashes.
Starts going out of your system. And that's what most things, maybe that's why alcohol has a lot of sugar in it. But with a lot of the drugs, it causes you depression. So a lot of times people will drink alcohol because they feel depressed and they feel like it's going to lift them up. When actuality, alcohol is depressant and it's going to cause you to be just more depressed. You have any other questions?
There was a question from Police Defend America. You asked the question, where should we draw the line?
Drug use, or before we use it. Because we don't know how any particular drug is going to affect us as an individual. Is it gonna, will you be one of those people that the first time you use it, you're chasing that high? You don't know that. We don't know that. So it's better not to start it. So I know we covered a lot of drugs, stimulants. Well, we covered all the major ones. So most drugs, whatever you find, they're going to fall under one of these categories, either a stimulant, depressant, hallucinogen, or narcotic, analgesic, or inhalant. And we need to be aware of our kids, what they're doing, you know, who their friends are, any changes in their behavior. They all of a sudden start acting a certain way or dressing a certain way, acting out of their character, then we need to investigate it.
There's a question, some of them are prescribed by doctors, should we decline?
Should we decline? I think that's something that you and your doctor need to decide. You talk to them, get the information, know what those drugs are doing, what are the benefits and everything, but that's a decision that you need to make with your doctor. That's just like I laugh all the time because I see these commercials, you know, and it's prescribed for one thing, but it's giving you 5 negative things on the other side. You know what I'm saying? But sometimes, depending on, you know, what you're going through, you know, sometimes it might be worth it for you, you know what I'm saying? And at whatever the prescription, because see, they're giving you doses depending on your weight, on just different things. So that's just really something you have to decide with your doctor.
And I think one of the interesting points that you made about is the large percentage of prescription drugs that are prescribed to Americans. And I, as someone who previously worked in the pharmaceutical industry, I knew, you know, you have a lunch in that office, scripts would go up like the next couple of weeks. And I do think it behooves us to do our due diligence, talk to our physicians, but also understand, you know, there's information out there. Also seek second opinions sometimes, you know, that's out there. Because I remember once again when I was a sales rep, I had a doctor tell me or ask me the question, what is the title given to the person who finishes last in their medical school class? Doctor. So you don't know if they were the cream of the crop or they just made it by.
This is something that's a good question, because you have to do your due diligence, find out, you know what I'm saying, what the side effects are. Yeah, but you know, make an informed decision, seek out a second opinion, and sometimes, you know, holistic medicine, there's a lot of holistic doctors out there also that are there, but that's just something that you have to make with your doctor. So we thank you all for this time. I'm going to close out with a quick word of prayer. Father, we just thank you for this time. We just ask you to help us to remember and retain everything that was taught on tonight, Lord, that it would benefit each one, Father. Lord, that as they go forth in ministry, Father, that they will know what these different drugs are and how they act in the body. So we just thank you and praise you. We just give you all the glory. Continue to bless each one of us.